the host of NPR's On Point, Tom Ashbrook.
Thank you, Magna. Thank you. Thank you very much. Thank you. Thank you. Ladies and gentlemen, let's start out with the hard stuff. Give us a story from the toughest moment of your time with Athena Healthcare.
We had really hard intellectual challenges, but the real hardship of entrepreneurship is emotional. It's not intellectual. Right? Problem solving. If you're into this, you get high on that stuff, and the problems are a lot easier than they were in school. I mean, these things are really simple: income, cost, revenue, cost, and then there's supposed to be more. I mean, that's addition. You know, I think Nicola knocked that out back in 5th grade. I got one of my kids here, a couple of them, but. So I think the real challenges are emotional. When have you gone too far into sand-digging robots? Or in my case, Athena Health was Athena Women's Health. We were a women's health company. I owned the largest freestanding birth center in America and employed 30 nurse midwives and was really involved in how the waiting room should feel because they were mine. And we said, look, if they can put that much expertise and process control and get into getting you a doppio latte with a drip nose dip. You know how they talk in Starbucks?
Yes,
when originally it was this mystical, I'd like a doppio tripio thing with a thing, doppio tripio thing with a thing, doppio tripio thing with a thing, and then this thing came and you're like, that was amazing.
Is that the sound of childbirth?
And so I thought to myself, like, why do you get treated like you're at the registry of motor vehicles when you're in life's most amazing miracle, and yet, you know, it's like the moment of quickening to get a latte. Like, we should be able to, and that's how Athena Health started, and that didn't work at all. I mean, it was a disaster. And we banged away and banged and just went deeper and deeper into a hopeless thing where it turned out that telling doctors how to practice medicine, even with your spanky new MBA from the Temple of Capitalism over in Alston, doesn't work. You know, not going to happen. That you're going to, and you know, we had this incredibly ambitious and dug, and the lowest. My partner Todd, who started it with me, his lowest point was when he realized that there were not enough Excel spreadsheets in the universe to convince.
This is Todd Park. As in Park, as in Korean American Todd.
Korean guy, yes, the parking magnate. And he came and quit in 1998 and said, you know, there is no number of spreadsheets that will make these doctors happy. But this is an emotional challenge, and entrepreneurship and the marketplace largely is emotional, which would cause you to do a show about whether the Keynesians or the monetarists or anybody could make there be good ideas or mojo. If there's no mojo, how do you use the Federal Reserve to stimulate mojo? Probably you don't. And that low point was where I think we started, was just that we couldn't actually make birth be better. And we had to humble ourselves to the idea that maybe we could start with something like the fact that we couldn't make payroll on any given month because our medical claims weren't getting paid.
And as I read your story, one of the huge barriers you were up against was the amount of paperwork you were required to submit to all the insurance companies to even be in this business.
Right. And in fact, we started with this, every time we got into an argument with the doctors in our one little group, it was like, how many MBAs does it take to change a light bulb? How many MBAs does it take to run one private practice? And it was like we were up to 5, and we still were a disaster. And each time, they're like, well, why do you think that? I'm like, well, it just seems like we ought to close the Main Street office because we're losing a ton of money there. Yes, but why do you think we are? Because I feel like there's a lot of opportunity. Well, I don't really know, but I mean, you know, we're losing money there. And, you know, and so each time we would get into these dialectical arguments with doctors who, turns out there was an amazing sunset at the Main Street office, and so the doctors really liked to have that office because you your charts and look out. I didn't get that, and so we would be developing, you know, model after model after model to try to prove ourselves and prove our decisions. And in that exhausting journey to nowhere that put out lots of, there was a whole sector of company called the physician practice. Ever remember the PPM industry? Physician practice management industry? Tons of companies going out of business, exploding sensationally. And we were like, yeah, so we've got it right because we've got this great model about midwives. No, you don't. But that model of trying to go after, and entrepreneurship is largely about going down abandoned mine shafts, just a tiny bit further than the guy who died down there and his skeleton can be found. You know.
Needing mojo stimulation. Todd Park's brother could write software.
Yes.
As I read your history,
couldn't
he sat
get
down.
paid, and we can't figure this out.
That is all the forms from the health insurance companies that you're required to.
And we just, where are they all, and what, you know, why didn't they get paid? And each one, there's some elaborate answer that involves 8-digit codes, and you know, you have to look up the code in the book, and so we got Todd's brother Eddie, who was like president of the Harvard Computer Science Society, and a bunch of his friends, but you know, came out and said, God, this is really quite interesting. You know, this is a disaster, and it's really complicated, and this internet thing could be big. And so we start with this clinical model that we really feel strongly about, and owning practices and employing providers, midwives, etc. And it felt beautiful, and my office was in the birth center, and we could hear through the HVAC each time a baby was born it was beautiful.
But not good enough.
But not making payroll ever. But the passion associated with getting down this thing allowed us to stay at it and get a brother and a cousin and a friend. And eventually we're like, well, you know, what we really ought to do is try to get these claims paid.
You were in Texas, as I recall, which was
San Diego, California. That was our first practice.
But I think you made a visit to Texas, which was Governor George's state at the time. You were maybe looking to sell the company.
Oh, the Texas VC.
They looked into, yeah, that's right.
So I'm trying to raise money for this midwife thing. We need one more shot, man. Just give me one more. I got this midwife thing figured out. You know, running around to VCs. And we were looking maybe $7 million pre-money valuation, you know, for the company, because the last one was $5 million, and I couldn't take the humiliation. So maybe a little creep up in pre-money, so my colleagues won't bail on me, because they're making a lot less money than they were making at Booz Allen. And I get this guy, and he says, well, I don't know. I'm thinking, son, I can get you, why not just give you $11 million for that Athena Net thing?
The online portion of what
and this
you were
was this
doing.
website that we built to keep track of where the first prenatal visits were happening and how to check eligibility with the Medicaid plan and how to figure out these. I was like, you mean that? $11 million?
What about
Let
my
me
midwives?
get back to you. I was like, oh, dude, I think I figured something out. You know, it was a Dallas VC, and he said, I'll give you $11 million for this application. I said, I think we need to focus on this application thing because this guy sees something that I don't see. You know, and, you know, 10 years later, that application is, we figured out the original, so the original mission was management infrastructure to make healthcare work as it should. And we're like, it's not management infrastructure. They don't want management. It's information infrastructure. And so we changed our vision statement. You're never supposed to change your vision. We're like, one change, just one change. Just that one word, and now information infrastructure to make healthcare work as it should. I felt like MacArthur, you know, okay, midwives, listen, I'll be back for you. You know, like, quick, hit the gas, get out of here.
Enjoy Baton.
Their Birkenstocks, you know, come back, wait. I have stock options. What's a stock option? And then we got, you know, this internet thing where we could actually take this and then I realized, oh my God, the problem with healthcare is we live way in the stratosphere. We talked to Tom Ashbrook about whether it should all be federalized or whether it should be regionalized or anything that ends with I's sounds like way too high, and the real problems are these practical, tactical, shameless little dumb bureaucratic things that we don't understand. We don't know if our patients are covered. Our patients don't know if they're covered. They don't know what it means to be covered. I don't know if I'm covered. Did you ever get a bill that says this is not a bill? You all did! All of you! That's so
And now, you are one of the nation's leading providers of internet-based business services for physician practices. Web-native software, not that pig is a prom
software-enabled
stuff.
service. Entrepreneurs, avoid software.
Okay, avoid software, get web-enabled.
Cost of doing business.
A continuously updated payer and clinical knowledge base and integrated back-office service operations. Athena Net supports nearly 20,000 medical providers in 40 states. The company currently manages over $3.7 billion in physician collections, processes more than 30 million claims and 6 million clinical documents per year. And yet you missed your first quarter earnings and your stock is down 7%.
Okay, so here's one of those things when you go public. We don't give guidance. So we don't miss earnings because we don't give out earnings.
They read your mind, baby, because you were 62
But they
cents
already
short.
gave us, and they're like, here's your earnings. I'm like, but I didn't go. I don't give guidance. Yeah, but don't miss this one. I'm like, but I didn't give you that. Yeah, but I've done my math, and that's what you should do. Who are you? Well, I work at UBS. You know, so there's a great dynamic, which is a whole nother, fire. So we need a whole nother fire to sit.